As we move beyond the age of 70, our bodies begin speaking to us more quietly, yet more urgently, often through signs we have learned to ignore for decades. And one of the most overlooked of these signals is mucus, that familiar substance we clear from our throats in the morning, blow into tissues during allergy season, or dismiss as a simple cold. Yet doctors now warn that in older adults, mucus is no longer just a minor inconvenience, but can become a powerful messenger of deeper health issues, developing beneath the surface, because aging changes how our lungs, sinuses, digestive system, and immune defenses function, making mucus thicker, slower to clear, and more likely to trap bacteria, viruses, and harmful particles, which means that after 70, the color, texture, smell, and frequency of mucus can reveal important clues about infections, inflammation, internal bleeding, or chronic disease, and understanding these signs can mean the difference between early treatment and dangerous delay. One of the most serious warnings doctors emphasize is blood-streaked mucus, which may appear as pink-red or rust-colored lines mixed with phlegm. And while occasional irritation can cause tiny blood vessels to break, persistent or recurring blood in mucus is never considered normal in seniors and may point to conditions such as pneumonia, tuberculosis, pulmonary embolism, or even lung cancer, especially when accompanied by unexplained weight loss, chest pain, night sweats, or fatigue, making it essential to seek medical attention rather than assuming it is a harmless result of coughing. Another dangerous type doctors caution against is thick yellow or green mucus that lingers for days or weeks, because while mild color changes can occur during a common cold, prolonged discolored mucus often signals a bacterial infection such as bronchitis, sinusitis, or pneumonia, which can progress rapidly in older adults due to weakened immune responses, reduced lung elasticity, and diminished cough reflexes, allowing infections to spread deeper into the respiratory system before symptoms become severe. And this is why seniors should be particularly alert if yellow or green mucus is paired with fever, shortness of breath, confusion, or chest tightness, as early antibiotics or targeted treatment can prevent hospitalization. Equally concerning is foul-smelling mucus, which doctors describe as a red flag that should never be ignored, because a strong, unpleasant odor may indicate tissue breakdown, abscess formation, or chronic bacterial growth deep within the sinuses or lungs, conditions that can quietly damage surrounding structures over time, especially in individuals with dentures, dry mouth, diabetes, or reduced saliva production, all common after 70, and since smell changes gradually, many seniors adjust to it without realizing something is wrong, making family members and caregivers vital allies in noticing changes and encouraging medical evaluation. Doctors also warn about excessive clear or foamy mucus, which may seem harmless because of its color but can actually reflect underlying heart or lung problems, particularly congestive heart failure or chronic obstructive pulmonary disease, where fluid backs up into the lungs and mixes with air, creating frothy sputum that worsens when lying flat or during the night. And this type of mucus often appears alongside swelling in the legs, sudden weight gain from fluid retention, or unusual fatigue. signs that the heart may be struggling to pump effectively, making prompt diagnosis critical for preserving quality of life. Another mucus type that deserves special attention after 70 is thick, sticky white mucus that is difficult to clear and seems to return repeatedly. As doctors explain that this can indicate chronic inflammation, asthma, dehydration, medication side effects, or long-standing lung disease, and because aging reduces thirst sensation, many seniors become chronically dehydrated without realizing it, leading to mucus that becomes dense and immobile, trapping pathogens and increasing the risk of repeated infections, which is why adequate hydration, humidified air, and medication reviews are often the first steps doctors recommend when this pattern appears. Beyond these specific types, physicians stress that the frequency and persistence of mucus matter just as much as its appearance, because mucus that continues for more than 2 or 3 weeks worsens instead of improving, or interferes with breathing, sleep, or speech should always be evaluated. As aging lungs are less forgiving and recover more slowly, turning minor irritations into major complications if ignored. It is also important to understand that medications commonly prescribed after 70, including blood pressure drugs, antidepressants, inhalers, and even acid reflux treatments, can alter mucus production and thickness, sometimes masking symptoms or creating new ones, which is why doctors urge seniors to discuss any noticeable changes. Rather than assuming they are simply part of aging, lifestyle factors also play a powerful role, as years of smoking, exposure to pollution, secondhand smoke, or occupational dust can leave lasting damage that reveals itself later in life. Through abnormal mucus patterns, and even long-quit smokers remain at increased risk for lung conditions decades later, making vigilance essential. Doctors emphasize that paying attention to mucus is not about fear, but awareness, because the body often whispers before it screams, offering subtle clues long before pain or crisis occurs. And seniors who learn to observe these signs empower themselves to seek help early, preserve independence, and avoid preventable hospital stays. Maintaining healthy mucus after 70 involves simple but meaningful habits, such as staying well hydrated, keeping indoor air moist, practicing gentle daily movement to support lung expansion, maintaining oral hygiene, managing reflux, and keeping vaccinations up to date to reduce respiratory infections, all while listening carefully to the body's signals. Family members and caregivers also play a crucial role by noticing changes seniors may overlook, asking gentle questions and encouraging checkups without judgment or alarm, reinforcing that seeking help is a sign of wisdom, not weakness. Ultimately, mucus is not something to be embarrassed about or dismissed, but a biological report card reflecting how well the lungs, heart, immune system, and hydration status are working together, and after 70, that report deserves attention and respect, because recognizing dangerous mucus early can lead to timely treatment, peace of mind, and more years spent breathing comfortably, sleeping soundly, and enjoying life's quiet moments. And here at Elder Echoes, we believe that aging is not about ignoring the body's messages, but learning to understand them with calm, clarity, and confidence, honoring the wisdom your body has earned over a lifetime and using that knowledge to protect the years still ahead. For more videos, subscribe my channel.